Namaskar. I think we have a very experienced surgeon, Dr. Dharmendra Nath. He's going to tell us more about aligned chopping in phaco.
Thank you very much. My topic of today is aligned chopping in phaco. It is a different type of concept and different instrument. So Nagahara initially, he presented his paper 1993 in ACRS regarding the chopping. So there are so many choppers and techniques came: Nagahara chop, stop and chop, pop and chop, bi-mill chop, quick chop, pre-chop, tilt chop. And in my opinion, there is one more, which is known as aligned chop. Two main categories are there. Nagahara is horizontal chopping, vertical chopping is too, as doctor has already discussed a lot. So all chopping techniques, manual instruments are used, replacing the ultrasound power, which is very important, just for the efficiency, safety, and reduces stress on the capsular bag. During the scalp, the nucleus is fixated by the in the capsular bag, more stress on the zonules. To reduce that, there is a kinesthetic, it's a kinesthetic, and we do not require much of the red reflex, and is done in mature cataract, and central 2 to 3 millimeter pupil zone is required in this technique. Is used for brunescence nuclei, white cataract, weak zonules, capsular exterior, and the small pupil. So these are the horizontal choppers, they are the vertical choppers, they are the differences between the horizontal vertical chopping, you know very well. And why this concept came: once you are doing the chopping, what happens? You hold the nucleus with a high vacuum. Even then, sometimes it rotates. It's a very common problem in the hard mature cataract. Just see, these are rotating. So the idea came into mind how to fix it and how to chop it nicely. Just see once again, it moves. It so happens in those cataract where the cortical matter is little liquefied. So it's not moving. Now, so the aligned chopping was designed by us. It's a blunt tip, 1 to 0.5 millimeter or 2 millimeter long blade is there. The blade is bent at 30 to 40 degree, 2 millimeter away from the blade. And it is 26 gauge shaft. Left-handed surgeon has left band, and right-handed surgeon the right band. So is the three-dimensional picture. So you can see very well, there is a blade, there is a band. So chopper is angled, insert at 30 to 40 degree away from the main port, follow the curve of the instrument. Because this is three-dimensional, so you have to follow the curve of the instrument. That is very important. Just see in the hard cataract how it cracks. Hold the half of the nucleus, and it is chopped from anterior posteriorly directly. It's a horizontal chopping. The rotation also facilitated with the same instrument. Hold it in the center, go to the periphery, and you just chop it towards the tip. This is centripetal force against the tip, and this is how it chops. So you can divide the nucleus as many fragments as you can. The more you have the fragment, the less is the corneal damage. So this is how, this is full thickness chopping is being done here. Keep rotating and hold again and chop it. We are not cracking it. Classically we are chopping it. In other instruments, most of the time it's a crack, not a chop. Now, make a big CCC. In hard cataract, try to do a 5.75 CCC. Hold, make a crater in the center, just see, and hold it with a high vacuum. Follow the curve of the chopper. This is angled. Hold the nucleus with a high vacuum, more than 300, 400, or if your machine allows to 500, hold it with the 500 vacuum, and see, going to the periphery, equator, and you just chop it, and it cracks full thickness. It doesn't allow the segment to rotate, which is very important. Again, rotate it and hold it again, and see the chopping. So main objective is to chop towards the tip. That is alignment. Phaco tip alignment chopping is this. Use of the chopper in grade 2 and grade 3 cataracts. In the soft cataract, you can do the vertical chopping with the same instrument because this chopper comes in the two forms, blunt and the sharp. Sharp for the vertical chopping and the blunt is for the horizontal chopping. See both here is the vertical chopping is done. And if you see, one side is the soft cataract and another side is the hard cataract. One video is not running, please. Okay, no problem. So have you seen this? This is a white cataract holding in the center with a high vacuum, go under the rhexis margin and just chop it. And it is a beautiful instrument to do the lateral separation of the fibers. You have to do every maneuver very softly and gently. Don't push it down because sometimes you use a sharp instrument because it cuts through and through. You can traumatize the posterior capsule with the sharp instrument. So just take a small instrument which comes as 1.1 millimeter, 1.5 millimeter and 2 millimeter blade. If you are doing the femtosecond, the button is taken out and do the gentle hydrodissection, take out the bubbles. I'm sorry taking a little more time. It's a beautiful instrument for this kind of situation, and the bubbles they are. Just only one video I will show it to you how it works actually in these cases. Just go inside and your chopper is inside again. Follow the curve at 30 degree and hold pre-segmented nuclei and separate it because this angle facilitates in separation of these. This is how it is separated. Thank you very much.
Thank you so much, sir. I mean, he has demonstrated how a small modification in the angle and the degree of one instrument can make things wonderful.